Thank you for joining the Bridge Shift today, an avenue to tell inspiring stories and understand those who tell them. It is our medium for live conversations with inspirational change makers.
Hi, I'm Lamise, your host for the Bridge Shift. Our guest speaker today is Dr. Sarah Mavrinac. Dr. Sarah is a Harvard-trained academic, an award-winning social entrepreneur, and a passionate advocate for life skill awareness and development. She led a professorial career at INSEAD, and in 2006, she launched her first enterprise, IDA, which was aimed to provide entrepreneurship skills to migrant women in Singapore. Her leadership and curriculum design were recognized at Singapore's International Woman of the Year. She is currently a health and wellness coach and trained in the field of culinary and nutrition sciences. She is currently also working on Azoki, a regenerative health initiative to empower individuals towards health literacy and wellness lifestyle. Thank you for joining us today, Dr. Sarah. So let's start this discussion by briefly going over the transformation that you've noticed with the healthcare system since the pandemic hit.
The COVID pandemic has absolutely transformed our healthcare system. It has provided a unique opportunity for us to see both the great strengths of our healthcare industry and its weaknesses. On the strength side, clearly, we have so much to be proud of in our innovativeness. We developed as a world all of these new therapeutics and vaccines and treatments so quickly. We also revealed how much caring is embedded in the system, which is tremendous. All of our frontline workers who stood up for us, all of the volunteers and the techs, fantastic. But we clearly saw also the weaknesses. And amongst the weaknesses, I have to say, first we have to address our cost. It is enormously expensive, the healthcare system as we have currently designed it. It's also enormously complicated, which means that it is prone to error. Whenever you have a complicated system, there's more possibility for things to go wrong. We've also very sadly seen a lot of injustice in the healthcare system. Not everybody receives the same types or quality of care. But the transformation that is occurring right now is working to address all of those weaknesses. And it is happening very, very fast. In just the past couple of years, we've seen an explosion in the investment in healthcare innovation. Between 2020 and 2021, the amount of money invested, particularly, doubled to almost $45 billion, which is a lot of money. And interestingly, what the money is focused on is digitization, which is the technology that will allow us to address all of the major weaknesses that we have. Certainly, technology can drive down cost. It can also reduce complications and the handoffs, particularly between one doctor and another or between a nurse and another. It can ensure that data is kept stable for everyone. And third, it can also address some of the injustices by ensuring that more people have access to their own health care. So I think we're going to see in the coming years an increased use of digitization for all of these reasons.
I agree. And you mentioned when we spoke, and just a while ago again, that you believe that this is the direction that the healthcare system is going towards, which is digitization. But what about the personal technologies or the, healthcare tools that we have that can help us also?
So you're absolutely, we are going to see this digitization, this technology increase in our hospitals and with our physicians. We're going to see, for example, much more telehealth. But you're right. Another phenomenon that will occur is a transfer of responsibility for our health from the doctors and the systems to ourselves because of the increased technology that each of us individually will have at our disposal.
That we already have, though.
We do already have. It is phenomenal how much we have. It's still, some of it is we're in early days now. And so we have 400,000 different apps available for us on the App Store. Not all of these apps are equally useful or informative. In fact, we've learned that 95% of the health apps that are downloaded today are actually deleted the same day because they're not that useful. But we're learning. With all of this invention and application, we're learning what is working and what is not. And so we're going to see an improvement in our health apps soon. But we also have so many other types of technology to use. Wearables, for example.
And I think you have brought some with you today.
I have brought some with us, indeed, indeed. So most of the wearables are used basically for monitoring and information, okay? But we are also seeing the emergence of diagnostic and, very importantly, therapeutic devices. And the therapeutic devices are those which can be used to actively treat a problem. Just for example, panic attacks. There are now some new wearables that are helping people control the emergence of a panic attack. Fascinating. And there are some new wearables that are being used or actively now to treat the paralysis that occurs after a stroke, using music, for example. But these are specialty devices that most of us hopefully will not see. Most of us will be using the monitoring devices that we can find here on this type of wearable, our phones, usually 3 types of wearables: phones, rings, like this Oura ring here, and patches. And this is one type of patch, which you can just stick on your body, usually right here. But there are many other types of patches, particularly used by athletes when they're trying to monitor their heart rate while they're exercising and see how their body is responding to various kinds of exercises or stressors.
Great. I know that like the current generation, like they don't know what a watch is anymore. We just know a smartwatch because it has everything there already. So it's like it has more than one function. And I think that's what like what's happening today. Like if you get a gadget or if you get a technology, it's supposed to serve you like in all aspects of your life, not just in one.
Absolutely.
Yeah.
And I think that is such a fabulous thing. I'm so looking forward to the days when, 5-year-olds actually can look at their watches and see, oh my gosh, I haven't moved for 30 minutes. I'm supposed to go move. That's such a wonderful thing. Or drink some more water, or laugh, or get themselves ready for bed.
Okay, so with all of these mediums and technology that we have, can we use them to identify chronic diseases and hereditary disorders?
Absolutely. I think that is entirely the point, actually. At the moment, these are all giving us fabulous information. That is pretty much what they are. They're data collection devices. What will happen in the future is that these devices will begin to give us more nudges and suggestions for change. Already they're trying to do that. The studies that are out there, the academic sort of perspective on all of this is that they're not quite so good yet. But they will get better, and they will begin to incorporate more and more behavioral change and opportunities. And once we really have those opportunities down, those technologies are better developed, we will be able to use them. I think, for example, this is a continuous glucose monitor. It's a rather old-fashioned one that I actually brought back from the States, but there are newer ones now that can be synced with your phone. And with this, you can see how your body responds to particular food. You might eat an apple, for example, and see that your blood sugar shoots immediately after eating it. But the new technologies will then be able to know that you should combine it based on all of the other research that's been done. And the world knows now that by combining food sources, you can dramatically change the way that your body responds to the food. So an apple with peanut butter, for example, the blood sugar will not be as immediately impacted. So just through food combinations. So these devices will be saying to you, next time, add a little peanut butter. Or they will be suggesting that you have more food at a particular time to keep your blood sugars level. Or they will be suggesting to you that you should go to bed now because your blood sugar is beginning to drop or something. So there will be more and more lifestyle recommendations provided to you in response to the data that is being retrieved by these devices from your own body. In the short term, though, that's a bit much to expect. We have to go through a learning process here, and I think it's going to be 5-10 years before these devices are all really, really effective. So this is the time now to become more health literate. I am such an advocate of health literacy. And health literacy, the definition is really that we know how to obtain, absorb, and use this type of information to alter our lifestyle decisions and our health decisions. Okay, so this is all about preventing and reversing potentially chronic illnesses. And for that health literacy, at the moment, we can't yet depend on this. We need to depend on people and on, for example, health coaches and community support services.
But let's just touch upon quickly, because I know that this is something that you've experienced, but I think it would maybe shock a lot of people as well, because maybe they don't know about it. But these technologies, they can also help with the genetic disorders.
Absolutely.
Genetic disorders.
Absolutely. What we have learned from all of the genetic research that has been done recently is that while we can never change our genes, we can absolutely change how they are expressed, right? That's the epigenetics idea. And so, yes, many diseases that we believe are genetic, like Alzheimer's disease, for example, or like autism, those, MS is another one. There are many, many diseases that we have just presumed are genetic and therefore can't be changed, but they absolutely can be changed. And so we can reverse autism. In fact, between 15 to 20% of all kids who are diagnosed with autism when they're young actually grow out of the disorder as they get older. Usually there's a bit of work associated with that growing out. But it's so exciting now too that Alzheimer's, which definitely people thought there was just a genetic predisposition to it, and if you had the gene, you would get it, and tough luck. That's not at all the case. People can reverse Alzheimer's now, and that is a wonderful thing, I think, for the world and for all of us individuals.
Yeah. Just hearing you talk about it, it just gives a lot of hope to everyone. And it's just that to get them to want to, explore more, to want to get that information, which is available to all the people now. I think you mentioned a website that could lead them to it.
There are so many new resources that we have, and this is all about health literacy again. So we have to get out there and explore. But one that I would strongly recommend that people use is called Okra. This is, and we can maybe put
we'll leave it in the
exactly in the description down below, so that people can access this. This is a site that was built by a company in the UK in partnership with the UK government, and they're largely working with the NHS, the National Health Services there, to provide more insights into which technologies are best, particularly as therapeutic devices for various illnesses. So you can go, and this is a free service, and anybody can go onto it and do research in their library. So far as yet, I believe that they have reviewed 7,000 different apps, not wearables, because there's only 1,200 different wearables, but 7,000 different apps. And amongst that are maybe 600, 800 different wearables. But you can search the website by diagnosis, for example. So if you're concerned about diabetes, or if you're concerned about autism, or if you're concerned about Alzheimer's or MS or osteoporosis, for example, I just did an osteoporosis search the other day. Fascinating what will come up. And so you can begin to see all of the various resources that you could use. The question is, again, though, once you get that resource, will you use the insights that the resource is providing you to do anything to change your life?
Yeah. Well, with that, what do you think, if there were like fundamentals, there are fundamentals to help us shift to a healthier lifestyle, what would be your recommendation?
There is no one healthy lifestyle, right? We are all unique. So each one of us is going to have our own optimal healthy lifestyle. So I think the first thing that people need to do is become more familiar with their own body. So I'm back again to using these various resources so that we can learn how our body responds, for example, to a night of better sleep, or turning off the social media an hour before bed, or beginning to eat gluten-free. We can see how our bodies respond and react to these changes in our lifestyle. And we can see which ones are most beneficial for us. I also recommend strongly journaling so that you can begin to keep track of the various patterns that you're beginning to see. You may be particularly effective after you've had a certain number of hours of sleep, or after you've had a certain number of hours of deep sleep. Deep sleep is something that you can influence by eating more fiber. Who'd think that? But deep sleep is what you need to go into in order to clean your brain out. So students who may be thinking about preparing themselves for an exam should probably begin, in addition to studying, they should begin eating a few more vegetables to get some more fiber. These are fascinating things to know. But so we should begin using more data. We should begin keeping track of it with journaling, for example. We should be thinking about getting health coaches, and we should be taking steps really to improve our lifestyle in a variety of different areas: diet, sleep, movement, and stress reduction, without question. And I have many, many suggestions on the stress reduction part too. But
so it's really telling people to start taking care of themselves, and telling them that there are tools out there that can help you reach the better version of yourself for life longevity.
That's it exactly. It's quite exciting. I think, again, as I suggested at the very beginning, that one of the great changes in the healthcare system will be a shifting of responsibility for our health from the institutions and the doctors to ourselves. And so we do need to step up as stewards of our own health and to begin reveling in that. When we are healthy, it is very good to be alive. And I believe that I have certainly advanced my health over the last number of years with this learning, and I strongly recommend it to everyone.
So from people learning how to cook their own meals and getting educated about what, again, listening to their body, like you mentioned, what works for them, getting it personalized, and then getting, I think you mentioned sophisticated therapy. Can you touch upon that?
So the sophisticated therapies, again, will be required when you diagnosed an issue. And so, for example, with diabetes, so many people have diabetes right now, or are overweight, or have thyroid disorders. All of those therapies can be treated gently. It's also right, of course, that your doctor prescribe you with medicines. I mean, at times medicines will be really needed, but we can ease the stress on our bodies of these disorders and the medications with cleaner lifestyles, with healthier. And for that, you're going to want to be looking in again at the ORCA database, seeing what tools are best for you, and probably pairing yourself up with a health coach. It is not expected that we would all become doctors or nurses. You know, we can't do that, but we can begin to rely on paraprofessionals like health coaches who can provide us with greater insight into how to approach some of these more sophisticated therapies.
So what would be your message to people who are still hesitant towards making the shift?
And there's so many people who are, because it can be scary to think about changing your lifestyle. I would, first of all, keep it simple. You just need to go to bed maybe 15 minutes earlier. That's one simple change that you could make that could improve your health quite dramatically. Keeping it simple, keeping it social, often doing this with friends or family members, that can make it a bit more fun. Going for a walk with a girlfriend every morning is such a delightful thing to do, not just for your body, but for your relationship with your friend. I would also strongly suggest that you take on some of the work on behalf of somebody else. So I think this is most powerful for moms. I began to do this work on behalf of my children for their health. And when your children are in need, everything we do is easier, right? It becomes a no-brainer. We just do it. And in the process, I learned so much, and I began to see what was working for me and my body, because I ate all the healthy organic food that I cooked for my kids. So keep it simple, keep it social, and do it on behalf of somebody else that you love. That's one way.
Right. Yes, that's beautiful. So it's taking care of yourself and your family and finding the right community to help you develop that lifestyle as well. And we're lucky because in this modern age, like, we have a lot of wellness facilities that cater to that. So
like the Bridge.
Yeah.
Phenomenal.
So with everything that we've discussed, what would be the message that you want to leave everyone?
That we are all unique. And we have a responsibility to ourselves, to care for ourselves as stewards of our own health. And I believe that the joys and rewards of caring for yourself, learning about yourself and how your body works, building your own user's manual, the rewards of that are so tremendous that you, after even attempting this for a while, will decide that there's no better way to live than with caring for yourself.
Beautiful. So if people want to connect with you, how can they reach you?
We are just beginning to put up a landing page right now. Our organization is working now to promote health literacy and health coaching. And you can find us at www.azoki, A-Z or Z, oki.org, O-R-G. And you could reach me at hello@azoki.org.
Thank you
I'd
so much.
be delighted to hear from people.
It was so lovely to have you today. Thank you so much, Dr. Sarah. And we look forward to all of the things that you are going to be offering with your new service.
Thank you.
To all our viewers, we're going to be leaving the details in the description below. Thank you so much for joining us today, and catch us on the next Bridge Shift.